This model represents the dissection of abdomen and the thoracic part of the human body, in which we are going to emphasize only on the abdominal muscles. So these muscles can be easily identified if we are clear about the orientation of the muscle fibers. The first muscle with the fibers directed downward, forwards and medially is the external oblique muscle, which is the most superficial of all the anterior abdominal wall muscles. Getting origin from the lower 8 ribs, the muscle fibers are inserted into the xiphoid process, linea alba, pubic tubercle and pubic crest. Deep to the external oblique muscle, there is another muscle which is the internal oblique. The orientation of its fibers is opposite to the external oblique, as they are directed upwards and medially. Origin of this muscle is from the lateral 2/3 of the inguinal ligament, lumbar fascia and the iliac crust, while the fibers are inserted into the lower 3 ribs and the costal cartilages, xiphoid process, linea alba and the pubic symphysis. The third muscle which is present in the midline is the rectus abdominis muscle. This muscle is enclosed by the rectus sheath both on the anterior aspect and the posterior aspect. Anteriorly, the rectus sheath completely covers the muscle. However, in the posterior side, it is deficient above the costal margin and below this line, which is referred as the arcuate line. So this is the rectus abdominis muscle. Orientation of the fibers of this muscle is longitudinal, which arise from pubic symphysis, pubic crest, and they are inserted into the 5, 6 and 7 costal cartilages along with the xiphoid process and the linea alba. So linea alba is actually the midline structure which is formed by the fusion of the aponeurosis of all 3 abdominal muscles. This is the site of linea semilunaris, which is at the lateral border of the rectus abdominis, and this is the site of umbilicus. When we do the deeper dissection beneath the external, internal oblique and rectus abdominis, we appreciate transversely running fibers of transversus abdominis muscle, which are best seen here in this model in the inner aspect. So these fibers, they arise from the lateral part of the inguinal ligament, lumbar fascia, lower 6 costal cartilages, and they are inserted medially into the xiphoid process, linea alba and the pubic symphysis. All these 4 muscles, they are supplied by the iliohypogastric ilioinguinal nerve as well as the lower 6 thoracic nerves. The rectus abdominis is only supplied by the lower 6 thoracic nerves. The main function of these muscles is to support the abdominal organs and assist in flexion and rotation of the trunk.